Hi, my name's Jeff Reith, and I'm from Canobolas Pet Hospital. And today we're going to talk about how to feed your dog. What's the right way to feed your dog? So, what options have we got as far as feeding your dog? You've got canned food, of course, dried dog biscuits, the semi-moist dog rolls, which are becoming more and more popular, and homemade diets, which again are growing in popularity too. There's quite a few, and Dr. Ian Billinghurst from Bathurst has made a name for himself by pushing his bath diet. We'll deal with some myths first of all. First myth is that dogs are meat eaters, and while they do eat meat and enjoy meat, they're certainly not just meat eaters. Meat is essentially just muscle. Um, it's really high in phosphorus and low in calcium, and so if you were just to feed meat to, say, a puppy, you'd induce rickets quite quickly. And you can see here this wolf. This is probably the most natural diet you can get for a canid. But you can see here that with this carcass, it's eaten bones, it's eaten intestines, it's eaten intestinal contents. So basically, if you got a whole sheep or a whole animal and ground it up and minced it all up, including intestinal contents, you'd probably have something akin to a perfect diet. Myth number two: it's cruel to have a hungry dog. Now, carnivores, what we've got to do is pull ourselves away from how we eat ourselves and how dogs eat. And we eat very differently. Carnivores have got to be able to feast and famine. They've got to be able to eat a hell of a lot of food in one hit because the food's not necessarily going to be there for another week. So, as a percentage of their body weight, they're actually able to take in a lot of food. Their stomach's able to expand a lot. And basically, dogs will always be hungry because there's a biological imperative there for them to put on weight as quickly as possible. We, however, are more grazers. We eat a little bit throughout the day, and that's best for us. But dogs will always be hungry. You don't have to feed them to the point where they're not hungry anymore. Myth number three, and I want to change everyone's perceptions a little bit on what's a healthy dog. Now, most people would look at this dog and say, yep, he's not too fat. Um, but that's not true. And I'm going to explain this a little bit later on as to why he's too fat. What we do with dogs, rather than going off body weight, rather than going off their how much they weigh, we go off body condition score, and that's mostly because they vary so much. They vary in body type, and so what we're really looking for is around the 3 and 4, I'd say, and I'm going to show you some evidence in a little while as to why I'd say 3 or 4 rather than 4 and 5. But if you can see that clearly, a 3 have got ribs showing, they've got a nice waist that you can see, and I like to just see a little point on the hip bone as well. So how many times a day do we feed our dogs? Lots of people actually leave the dog food out constantly throughout the day, and those people have got very fat dogs, of course, but humans tend to eat 3 times a day. Some people say you're better off eating 6 times a day. That's not true with dogs. Dogs are quite happy eating 7 or 6 times a week. Um, and I know for a fact that the police dogs, the sniffer dogs, they will just feed them 6 times a week, and it will be anywhere between 2 hours apart and 2 days apart. They don't want a dog that's on duty at say 6 o'clock at night, pulling up stumps and saying, "Okay, I've had enough. It's time for my meal." So, what should we feed our dog? Dog food is my answer, and that always surprises some people because they're expecting a complicated answer. But the truth is, dog food companies are very good at supplying a balanced diet. Um, the nutritional facts of most dog foods is that dogs are by and large being fed better than their owners are. Um, and it's not terribly difficult to follow what's called the NRC uh, requirements. And if a batch of dog food doesn't meet them, then it's not too difficult to throw in, I don't know, something like extra calcium or extra zinc. Um, and the good news is that there's been studies on whether what's on the side of the pack and what's actually in the dog food is the same. And pretty well what you see on the side of the pack is pretty well spot on. There's a few slight differences there if you read that paper, but there's nothing really significant that we're going to get too upset about. And they're safe and convenient, of course, because uh, in the old days we used to see a lot of nutritional problems, but also bacterial things. When you're feeding a raw meat diet, often you'll have bacterial contamination, and you can't say that dried dog biscuits aren't very easy to use. It's not like you've got to clean up much afterwards, and um, they don't make much of a mess. So then the next question that I'm always asked is, what brand would you buy? Now, let's take out the bottom, say, 10% of brands. Those really horrible things that look like chook pellets. On the left here, we've got a well-known um, brand. It's probably at the cheaper end of the market. But I always say to people, from about Chum, which is the cheaper end of the market, right up to the most expensive premium brands like Eukanuba on the right there, um, they're all nutritionally balanced. The difference in cost is where they get their protein from. Now, Chum will use a lot of vegetable proteins, and if you look on the side of the packet, you'll probably find that Chum has got a higher crude protein than a high quality food like Eukanuba. That's because Eukanuba is using animal source proteins. So they're much higher quality for a carnivore. So to get the equivalent in protein for Chum, because it's poor quality protein, they've got to add more. So if you look on the side of the pack, you might think Chum's better, but it's not. They're just using more plant-based proteins, um, which it's harder to get a balanced diet. So anywhere from Chum upwards depends on your pocket. Don't care which brand really. They're all pretty good. And what we're doing more and more nowadays is, rather than saying, okay, what is okay, right along the plateau of that top graph, along the plateau there, we could be feeding one of the nutrients, and there's a wide range. There's not a perfect, for any nutrient, there's not a perfect amount. These more expensive brands are going for optimum. They're actually trying to get everything exactly perfect, or even better than perfect. And a good example of that would be with some of their omega-3 oils. They're adding those to them, whereas the cheaper ones don't have them. So the question is, canned versus dry versus dog rolls, the semi-moist food. Now, I'd say canned and dry dog food is basically the same, except for the water content. Nutritionally, they are almost identical, depending on the brand, of course. And whatever flavours you get, they will still, even if you were to get a marrowbone versus a lamb flavour, they are still going to top those up so that they are nutritionally okay. Um, so whether it's canned or dry, I don't care. I'd probably say canned is better because of the higher moisture content, and that doesn't do any harm at all. But either way. Now, I've got something against the semi-moist dog rolls, though, and I'm sure they've got this corrected now. But if you didn't see this headline, this is a headline from last year, and VIP, which is the brand on top there, was found to be putting in, I think it was something like 400 times the amount of sulfur dioxide. Now, sulfur dioxide is a preservative, um, and that's okay. We've got sulfur dioxide in a lot of different foods and drinks, and it's not terribly harmful, except when it's in high levels. Now, the levels that they found in these VIP dog rolls were sufficient to wipe out 98% of the vitamin B1, the thiamine, in the diet. Now, this poor little Roddy um, was on these VIP dog rolls and got thiamine deficiency, which causes a malacia, a hole in the brain, and the brain stops working properly, and they end up with all sorts of funny neurological things of turning their heads and going round and round in circles. Luckily, though, if you get it early enough, you can actually treat it with some B vitamins. But look, I'm not a fan of these just because of the high preservative contents. So let's get down to the nitty gritty. How much are we going to feed? Whatever you do, don't feed what they tell you to on the side of the pack, because most dog foods that I've come across, you'll find that they're in the business of trying to sell dog food, of course, and as such, they will tell you, I think most of the time I calculate between 2 and 3 times what you actually need to feed them. Um, so my general rule is to feed to the body condition score. That's what the BCS there is. Feed to the body condition score, and you want about a 3 or a 4, I think. And you want to be able to see their ribs have um, a nice waist there as well. If you don't think you can do that, if you feed a thin dog more and feed a fat dog less, if you don't have the nerve to look at your dog in the big brown eyes and stop feeding him, then you can go with the 5 minute rule. Now, a dog should be able to eat what they need to for the whole day in 5 minutes. So just time it, and that's probably the easiest one. And if you want to get scientific, then it's 30 times their body weight. That's the BW there in the middle. So 30 times their body weight plus 70 equals their daily kilocalories. And you can look on the side of the pack as to the precise amount of kilocalories in each dog food. They do vary a little bit, but by and large, normal dry dog food is 300 per 100 grams. Premium dog foods like the Eukanuba that we saw before, it's 400 kilocalories per 100 grams. And most canned foods are around that 100 kilocalories per 100 grams. So it's not terribly difficult to work out how much your dog should be having. How often? That's easy. Once a day is more than enough. You don't need to feed any more than that. And um, leaving dog food out, you're going to be in trouble. So people then ask me, aren't they going to get bored? Don't I need to feed something else? They can't just survive on dog food. But the whole idea of dog food is that in one food, there's a complete meal then. But we also want to look after their teeth, and raw bones are excellent for that. Um, Dry dog biscuits don't look after their teeth, as a lot of people think, because as soon as they sink their teeth into it, they crack. And so the dry dog food doesn't run up their teeth the same way that bones might. So whether it's chicken necks for smaller dogs, you can get carcasses and thigh bones cut in half and lamb flaps and all sorts of dog bones around now. Um, and of course they need a supply of clean water. Now, table scraps. I feed my dogs table scraps all the time, but by and large, table scraps shouldn't make up more than a quarter of the diet. If you feed more than a quarter of the diet, 25% of your dog's diet is made up of something other than dog food, then you need to talk to a vet and try and get that diet a little bit more balanced. If you're feeding the raw meat diets that we were talking about before, they're unbalanced, and we're going to come to that later on. So things to avoid: ham around Christmas time or just after Christmas. I see lots of dogs that have been given the ham bone once it's past its use-by date, and they come in vomiting. Cooked bones, everyone sort of seems to know that nowadays. The worst cooked bones are the lot of chopped bones because they've got those little spiky bits, and they tend to stick. Corn cobs, I've pulled plenty of corn cobs out of dogs' intestines, and they're funny. When they get blocked up with a corn cob, it doesn't just block them up straight away like putting a plug in a hole. It takes them a week or two of being unwell because the intestines actually, in a largish dog, and the intestines are able to push the corn cob sort of halfway through, and it slowly all just grinds to a halt. Grapes and dried fruit is one. It causes renal failure. Onions will cause anemia. Avocado has got an ingredient or a chemical in it which will cause gastrointestinal problems. Now, chocolate's a funny one because everyone knows that chocolate is poisonous to dogs, don't we? Chocolate, in the 75 years experience that all the vets combined have got at the vet clinic, no one's ever seen a chocolate poisoning, and I doubt in my career I will ever see one. Chocolate theoretically is toxic to dogs. The active ingredient in it is not dissimilar to caffeine and similar in effects. But for a dog, average sized dog, 15 kg dog, would have to eat 3 or 4 bars of chocolate, really hoe into it. And then it will cause some muscle shakes, and theoretically it can go on to seizures and death, but yeah, not really. Fat, the little fatty bits off the barbecue, and that will cause pancreatitis. Milk will cause diarrhea in most dogs. Most dogs are lactose intolerant, um, but it's not the end of the world type diarrhea. It's just a little bit loose stool. And xylitol, which I'm not even sure whether that's in Australia at the moment because that's a artificial sweetener. It's used a lot in things like chewing gums and lollies in America, but I've never actually been able to find it. But I'm sure it'll make its way here sometime. Now, there are some special situations as far as diet's concerned, and obviously when a dog's unwell with heart disease or intestinal allergies, kidney disease, that sort of thing. Your vet's going to tell you what to do, and there are what's called therapeutic diets, and we've got them in the waiting room there. If you walk into the waiting room, you can see them. They are specifically designed for various conditions. The most common one that we probably use is the KD, which is the kidney disease diet. Young large breed dogs. This is really important for any dog that's going to get I don't know anything above Labrador size. They're very prone to a joint disease called OCD, and OCD is very closely linked to diet, specifically linked to feeding your dog too much, so making them grow too quickly, having too much protein in their diet, and having too much calcium. Now, that last one, there are lots of people that have come in from pet shops and they say, oh, the pet shop gave me a calcium supplement because my dog's so big it needs it. Calcium's a funny mineral in that, yes, you do need a certain amount of it, but it's as much as anything, it's the balance between calcium and phosphorus that's important. And if you throw that out, you will cause OCD in your dog. And if you get it in the wrong joint, you can get it in a shoulder joint, and we operate, and it goes quite well. But elbows and hock joints just do not go well, whether you do surgery or medical treatment. Now, large breed adult dogs are also at risk of a disease called bloat. And if you've got something like a German Shepherd, or even, I don't know, Great Danes are very prone to it as well, then you probably should speak to your vet about how to feed your dog. Generally, a few small meals throughout the day, avoid exercise after eating, and vary the size of the chunks of food so it's not all one homogeneous mess. Now, the last one is obesity, and it's a big one. So we'll come back to our friend here who we saw before. Most of you, I think, would say that he's not obese, whereas I'm going to say he is. And it's based on some good evidence. Most of you would say he's too thin. Now, I often say to people, if I show them a picture like that, what disease is associated with being that thin? And they can't think of one, and neither can I. I don't think there is one from being that thin. I think they might be a little bit more prone to the cold, but that might be just about it. I'd say that one is probably too thin, but in this paper, they had groups of Labradors, 48 of them in total. Now, they split them up. One group was fed a normal amount of food, probably not even enough to keep the dogs in the condition that that first Labrador was in. And then the next lot was fed a 25% decreased calorie restricted diet, so 25% less than the other group of dogs. And this was a long-term study. This was over the whole lifetime of the dogs. The amazing thing was, all they were looking for really was the effect upon the hip joints of the different diets. But what they found was a plethora of different effects. Firstly, these dogs that were fed less and were probably not far off being as skinny as that second dog that we saw, these dogs that were fed less lived for 2.8 years longer than their cohorts, than the mates that were being fed normally. 2.8 years is a long time for a dog. It's a quarter. It'd be 20, 25 years to us. Imagine if a doctor told you that if you ate a certain way, you could live another 25 years longer. Not only that, but these dogs that were fed less had less degenerative illnesses. And when they did occur, they occurred later in life. So not only were there less things like hip dysplasia and heart disease and that sort of thing, but if they occurred when they were older. So the evidence based upon this study is that the second dog that we just saw is actually healthier than the first dog that we saw. Not many of you are going to believe me on that one. Now, this is a big study. I think they had something like 21,000 dogs in this study that they looked at, and they found about 30% of them were obese. And based upon that previous study that we just saw, I'd say maybe we need to reduce or swing back the other way to want our dogs to be thinner. So maybe even more than 30% of them could be classified as obese. And again, lots of people have had a look at the way that people feed their dogs, and it's good to see here that on the right-hand column here, you can actually see that most people are feeding their dogs commercial pet food as the majority of things, but they're feeding way too much of it. Now, this talking about obesity, there's lots of different supplements that you can get for humans, and lots that are being sold for dogs to try and reduce their weight. So not only restricting their food, increasing exercise, which those two things make obvious sense, but there's lots of things in the market that you sprinkle on their food to try and make them lose weight better. This was a big study looking into various different products, and the only one that seemed to have a beneficial effect is a thing called L-carnitine, which you can get in like bodybuilding centers, that sort of thing. Bodybuilders use it all the time. L-carnitine, it's called. It's also as a going off on a bit of a tangent here. It's also been shown to have some beneficial effects in stopping large breed dogs getting heart disease if fed from puppyhood. So L-carnitine seems to be a good thing all round. Now, what about adding some stuff? And the fish oils and the glucosamines have become very popular lately. Um, but people use vitamins all the time. I think, given that the dog food companies are being very, very careful about making sure that their dog food meets all the recommendations, all the current recommendations. I don't think we need to add anything more. But the good news is that this paper that was written out of America, it's in a journal called JAVMA, which is a very well regarded one, journal of the American Veterinary Medical Association. They didn't seem to think that there was any need for any dietary supplements either. So let's get on to the raw meaty bones issue, which is the homemade diet. And proponents of this just love it. They are completely in love with the raw meaty bones diet. And the closest person that we've got advocating it, and Ian's done quite well out of it, he's got a couple of books out about his raw meaty bones, is the BAF diet. Now, Ian's over in Bathurst, he's got a vet clinic over in Bathurst, but speaks extensively throughout the world on this diet. The trouble is, and Ian's diet was actually in this study. Um, the trouble is that these diets have been shown to be low in zinc, a little bit high in vitamin E and vitamin D, which they're fat soluble vitamins. That's not a good thing because you retain those. It's not like you excrete them. But the zinc and the magnesium and the potassium were the two things that they're a little bit low in. The calcium phosphorus ratio was a little bit out as well from memory. So look, nutritionally, the advocates of these diets, um, when you look at it objectively and do an analysis, they've been proven not to be as good in comparison to commercial dog food. They don't meet the NRC requirements. And the other concern, of course, is that there are bacterial and protozoal contaminations of raw meat diets, and that not only has got implications for the dog, and in this study they actually found a very nasty E. coli in one of them. But we're looking for Campylobacter and Salmonella. These things are really common disease-causing bacteria in people. Um, but because they're not um, completely nutritionally correct, of course, they can cause all sorts of problems. And here's a case study of a puppy that had a raw meat diet, some public health concerns as well about feeding these types of foods, um, and just another example of a homemade diet causing problems, more obviously very bad problems. And that's the end of what we're going to talk about. I hope you learned something. These guys are obviously Labradors looking for the trash can. We'll see you next time with another topic.